Dr. Darien is here with a question from one of you. This one is from Beth J. What is a thyroid nodule?
So, Beth, thyroid nodules are quite common, and they can often be really concerning, especially if you've been told that you have one, because your biggest fear often is cancer. But just to remember, if you found a thyroid nodule, if your doctor tells you that you have a thyroid nodule, rarely are they cancer. Less commonly, 5 to 15% at most are often due to cancer, and the rest are often due to other benign or non-important reasons that you still need to get checked out. So the check or the test is often something called a fine needle aspiration done with a needle. This is relatively low risk, and if you find that there is something concerning, that might then lead you to getting a surgical incision where you would need to remove the thyroid nodule or a part of the thyroid itself. Again, these are very common things that are found on exams. It is so important to follow up. Again, most importantly, it's often not a problem, but if it is, early detection is what gives you your best outcome.
Got another question for you because the viewers love you, of course. This is from Hung right here. What are the signs and symptoms of anemia?
In the emergency room, I feel like I probably have this conversation at least once a shift. So anemia can either be sudden or it can be chronic. When it's sudden, usually you're feeling that shortness of breath. Sometimes you're having palpitations or sudden weakness. When it's chronic, which I would say is more common, those can be really, really complex symptoms that might be intertwined into what you might think are other things. For example, just chronic fatigue, or even signs of depression, or just exercise intolerance where you can't get yourself up and do the things that you want to do. So it's important if you have these symptoms to talk to your provider, because not all anemias are the same, and that's what blood tests are for, to differentiate and find the reasons. Is it because you're having bleeding, or is it a nutritional deficiency? All of these can be reasons and more.
Your prescription for wellness.
Speaking of tests, let's talk about what to do when you're getting a blood test. This is something that obviously all of us get done, but you don't know necessarily what questions to ask. So today's prescription for wellness are on what things you should know before you get your test. Number one, you want to know why you're getting the test. Is it a general test, or is it for specific reasons or symptoms? Also, check with your doctor about restrictions. Tests can be affected by your recent exercise, a recent diet, even certain medications. And then most importantly, keeping copies of all your tests, especially if you're going to talk to a new provider, consult a specialist, or if you're visiting the emergency room and you've never been to that hospital. And when patients bring in their numbers, it's really helpful for me to compare and contrast to try to find out what is new and what isn't.
You don't just have those numbers in your computer?
You would think so, but not every hospital is the same, and we don't often share information. Eva, I wish that'll be my next goal in life.
I just always assume that they have it all.
You always, and I can understand that, but you would be surprised. It's more difficult than you think.
Good to know.
All right, Doc, thank you. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions at ABC GA Big 3.